Hey, it's Dr. Troy here, the Osteoarthritis Chiropractor. You know, nowadays with the baby boomers and people getting older, there's a lot of people being diagnosed with osteoarthritis. They go in because they have pain, neck, back, hip, shoulder, and the doctor will say, oh, you have osteoarthritis. And so what's the solution? The medical approach is to write prescriptions for painkillers, muscle relaxers, or even cortisone shots, injections, and sometimes even surgery. But we got to rewind a little bit here, because what causes osteoarthritis? Well, there's two things that happen. One is there's been trauma to a joint or the spine, and the joints aren't moving properly. So the other component is lack of motion, because motion brings nutrients into a joint. So the joint's been traumatized and or lack of movement. So here we have a nice cervical curve. Let's use the neck, for example, and this can happen in any joint. Neck's in alignment. There's been some sort of thing physically or mentally or chemically that has caused tension on the body, and then the body responds by shifting out of alignment, which is fine. We call this level 1, but over time, that level 1, we start seeing degenerative changes. Early signs, there's calcium and extra bone being laid down to support the weight of the head or the joint so that the body doesn't collapse naturally. And then over time, it continues to build more and more bone. You can see the spurring here, the calcium. This is osteoarthritis. That means bone arthritis or bone inflammation. That's what the word breaks down. And then over time, now we've got even more loss of disc height. You can see the more white calcium deposits, more bones being laid down to support the weight of the head due to this misaligned area. And so it's supporting this. And so osteoarthritis in itself is not painful. So you can have somebody who's got osteoarthritis lit up throughout their whole spine. They're totally fine if they sit there. But guess what? They go and mow the lawn. They go and wash the dog or lift chicken food or vacuum or do the dishes, and all of a sudden, oh, my back hurts, my neck hurts, now my knee hurts. They were fine until they did activities that exacerbated it. So if you're suffering from osteoarthritis, chiropractic may be right for you. Get the joints moving again. They're never going to be 100%, but if you took someone from a pain level of a 9 out of 10 down to a 3 out of 10 and got them 60% or 70% relief, that could change their life. That could change their activities of daily living. There's also some nutritional things you can do. One of the things we highly recommend people that have osteoarthritis is they get on Wuji Chlorella. It's an anti-inflammatory. It's a whole food, vitamin, mineral, and it's a great thing for patients with osteoarthritis. If you're interested in more information, call our office 360-260-6903. Free consultation to determine if chiropractic's right for you. And if you're experiencing any issues related to osteoarthritis, we may be able to help you. Give our office a call. One of our doctors will be happy to take care of you.